Welcome to the Deep Dive. Today we're getting into something really important for your health, but maybe a bit confusing sometimes. The thyroid blood test.
That's right. We've been digging into the information on the Blood Test UK website.
Yeah, our mission today is basically twofold. Understand why this test is so beneficial for you, and then look at how you actually get it done, using Wolverhampton as a specific example from their guide.
Okay, so let's start simple. The thyroid test itself.
Right. What is it actually checking? Well, it looks at hormone levels, things like TSH, T4, T3, these acronyms you hear.
Think of it like this. TSH is kind of like the signal telling your thyroid gland, hey, work harder or ease off.
Exactly. And T4 and T3, they're the results of that signal. They're the hormones that actually manage your body's energy, how fast things run.
So if you're feeling off, maybe super tired, or your weight's changing unexpectedly, this test helps figure out if that signal or the response is out of balance. Is your thyroid too slow, too fast?
It gets right to the heart of it.
And what's really powerful, according to the Blood Test UK info, is catching problems early.
The early detection piece. Yeah.
Yeah, because thyroid issues are, well, they're sneaky sometimes. They can look like other things.
Like what?
Well, the sources mention things like depression or maybe anxiety. Sometimes even symptoms people think are just part of menopause. An underactive thyroid can mimic those.
So this test isn't just a number, it's about getting the right diagnosis quickly, cutting through the confusion.
Precisely. It avoids going down the wrong path for treatment.
And thinking bigger picture, it's not just about avoiding sickness, is it? It's about feeling better day to day.
Oh, totally. The materials really highlight that. When your thyroid hormones are balanced, you generally have better energy.
Less of that brain fog people talk about.
Yes, clearer thinking. And it can really help with your mood, too. It's genuinely about improving your quality of life, proactively.
Okay, so let's bring this down to the local level. You mentioned the Wolverhampton guide from Blood Test UK. How does this play out there?
Well, the guide points to local experts. I think Dr. Jane Smith was mentioned as an example, really pushing for this kind of regular checking.
Especially if you have those subtle symptoms.
Exactly. That fatigue that just won't go away, maybe feeling cold all the time when others aren't. They're saying don't ignore that stuff. Get tested.
Because catching it early helps avoid bigger issues later.
Right. They specifically mention things like reducing the risk of heart disease linked to untreated thyroid problems.
So for someone actually in Wolverhampton or maybe in a similar area, how do they go about getting this test? What are the options?
The guide lays it out pretty clearly. Your first stop is usually your GP through the NHS. That's often the main route.
Standard procedure. Makes sense.
But there are other routes too. The guide mentions private clinics, like the Wolverhampton Clinic was one example given.
For potentially quicker access or maybe more flexibility.
Could be, yeah. The advice seems to be whether you go NHS or private, check things like patient reviews, make sure it's properly accredited, and pick somewhere convenient so you'll actually follow through with appointments.
Good practical advice. And speaking of practical, there was a key tip in the guide about preparing for the test, wasn't there? Something often missed.
Oh yes, really important. Generally, you don't need to fast, which is good.
Okay.
But, and this is crucial, you absolutely have to tell your doctor about any medications you're taking. All of them.
Why is that so critical?
Because some drugs can really mess with the results. The guide specifically calls out things like lithium and also medications containing estrogen.
So they can make the results look wrong?
Yeah, they can potentially make it look like you have a thyroid problem when you don't, or maybe hide one that you do have. It could lead to a complete misdiagnosis.
Wow, okay, so definitely mention all your meds. Got it.
So tying this all together,
Yeah,
the test itself is just the first step, really. It's the snapshot.
right. It tells you what's happening now.
But for people who are diagnosed, or maybe whose results are borderline, the sources emphasize that ongoing monitoring is key. Regular checks.
To make sure treatment is working or if adjustments are needed.
Exactly, to keep things balanced long term.
That leads to a final point, something the guide touched on. We've focused a lot on the test, the clinical side. But what about lifestyle?
Good question. And yes, the Blood Test UK material does bring that up. It mentions things like diet, ensuring you get enough iodine, for instance.
Which is important for thyroid function.
And also managing stress. That seems to be a recurring theme for overall thyroid health, even after you've got your diagnosis and treatment sorted.
So the takeaway is knowing about the test, how to access it locally, like in Wolverhampton, that gives you power. Power to manage your energy, your mood.
Definitely. It empowers you to take control.
And for those crucial details on diet and stress, definitely check out the full guide on the Blood Test UK website. It's worth exploring.